Welcome to Justice Talks. This is the podcast where we use trauma responsive practices to inform criminal justice reform. My name is Dr. Lori Hall, and today I'm joined by two guests. If you want to introduce yourselves.
Carrie Hopkins Isles, and I'm a visiting instructor.
I'm Eli Haggerty, and I'm a student.
Awesome. Thank y'all for joining me today. So the topic that we're going to be discussing today is when justice equals punishment. So I think largely within the justice system and, culturally, we kind of equate this idea of justice as getting punishment, right? It's rooted in just desserts, right? This idea that individuals are punished for the things that they do. And often when we talk about punishment, largely what we really mean is like a loss of freedom. We mean that these individuals are locked up or they're receiving some time of incarceration. But I want to engage us in this idea that justice can occur without this loss of freedom, without what we're considering this swift punishment. What are your ideas about that?
I agree. I feel strongly about that since a lot of my background is with substance use and mental health. So people who have substance use disorder, just to stick with that example, is it just to put them away in prison for a certain period of time rather than to try to work on this substance use disorder that they have? Same thing with mental health and other issues. So I guess a lot of it goes to what's our goal, right? For me, I would like people to have an experience with the criminal justice system that changes behavior in the future to less,
I love that.
So that they're not reoffending. Yeah. The system as we have it now, it's about 2/3 that come out and reoffend again. So there's obviously something that's not working. So, and, I was thinking about what is justice, right? So there's a big moral component, and I don't know that it's moral to just throw someone in with, a loss of freedom if they have something that clearly they need assistance with to be able to be a different person moving forward.
I would even argue further, like that moral aspect of it for me is stripping someone of their freedom morally right, period, regardless.
Yeah.
Right?
Yeah.
That's, to me, that's creating, like when we say, oh, only the individuals who don't meet the criteria for something else, some extraneous thing, should be locked up, right? That's like, to me, saying or creating like a quantification of or a hierarchy of offending. I would argue that morally it's wrong, right? To strip someone of their basic humanity. And because that's really what we're talking about when we talk about loss of freedom. A lot of people want to say loss of freedom is really just about like your ability to move about, but it's a much more complex thing that people are losing when they're incarcerated.
Well, not to mention the fact that I use this example in my classes a lot. So if my child gets punished, if they have to stay in their room for some period of time, I don't go in their room and start kicking them, right? Yeah. But when people are in jail and prison, there's often abuse and, poor treatment and all these other things. So there's even if you felt okay with the loss of freedom being the consequence, that's not the only thing that happens.
Right.
And a lot of people in society are like, well, that's what they get, and are even supportive of that. So that to me is scary. And,
I think that that's extremely scary when people can look at the dehumanization of individuals and say that someone deserves it. I think that that's the bigger issue that we have to like really kind of break apart. Why do we think that about people? Right?
Who've made mistakes, which I can't speak for you guys, but I've made mistakes. They might not have been illegal, but they were, mistakes.
Yeah, absolutely. I was at ACJS a couple of weeks back, and there was a lady at our presentation who provided us with a resource. There's a website called We're All Criminals. Oh. And basically she says that 4 out of 4 of us have committed a crime, but only 1 out of 4 of us have been arrested, right? that could not be truer to me.
Mhm.
Right. I don't need anything other than that statement to
Sure.
corroborate it. Like
Mhm.
that is absolutely the truth. And you'll hear all the time, people are like, oh, it's not illegal unless you get caught. Well, it is illegal, right?
Of course.
It's just, no, the
No.
vast majority of crime goes unreported,
Mm-hmm.
undetected, and we're not aware of it. And it's not to say that the people that get away
Mhm.
are better than,
Right.
right? It's just, they didn't get detected.
And are the reasons, again, just reasons. We were just talking in class
Yeah.
about, conflict theory and
Mhm.
Marxism. And so were these differences because of class, race, gender?
Absolutely.
And we know they are,
Right.
at least to
And
some extent.
yeah, because we have decided that certain communities need to be policed more heavily. We have this conversation about crime that occurs basically in lower income communities, minority communities versus crimes that occur in predominantly white or, middle class or upper class neighborhoods. And crime is everywhere. It occurs everywhere. It knows no class. It knows no race. It knows no boundaries. It's about the visibility, right? And the policing that we're doing, the policing practices. I've heard countless police chiefs and officers even say, I can influence crime rates. Like, I can make them say anything. I can, put a higher police presence in one area
Exactly.
and reduce the police presence in another area. And
Mhm.
I'll have you thinking that it's bad here and good here. When in the fact is it's the same everywhere.
You're just seeing it. It's visibility.
Right.
We talk about like hotspot policing,
Yep.
people going
Mhm.
to an area that has traditionally been known to have crime. Well, once you go in, you're going to see things, I mean,
Yeah.
again, I always use my kids. If I'm sitting with my kid all day and watching them while they do whatever, I'm going to be like, what are you doing? But if they're in their room and for the most part doing okay,
Yeah.
I just didn't see it.
I mean, that's a good example. I think like when we're home as parents, right?
Mhm.
And even if you think about like surveillance,
Mhm.
our children behave better, right? Say you have multiple children.
Mhm.
When you're home, they behave better, right? And then when you leave, it's like suddenly you're getting the phone calls.
Oh,
She
yeah.
did this, he did
Oh, yeah.
that, like so and so did this, or you come back and you're like, why did this happen? What's
Yep.
this is missing, that's broke. Like
Yeah.
what's going on, right?
Right.
And it's really the same kind of concept. And even if you think about like you being home, right? And they're in their rooms. You don't know what's going on.
No.
They could be doing the exact same thing, like you have no idea. It's the undetected, like we're not surveilling it in that way. And so, when we think about the ways that we go about thinking about individuals who do get detected,
Mhm.
right? We suddenly create this stigma and this inferiority and, well, they shouldn't have done that. And I think it's highlighted when you see wealthier people become, like they get detected for whatever they've done and now
Mhm.
they're incarcerated and going through the system.
Mhm.
You see it highlighted even more on like, look, these people have been going undetected and you thought that they were wonderful people, right?
Mhm.
Great people.
Mhm.
I'm thinking of so many examples.
Oh, yeah.
Right. And then all of the sudden, the narrative changes,
Yes.
right? Because they became detected.
Mhm.
They're the same person.
Or they're given some level of empathy and compassion that other people aren't.
Mm.
So like an example I use in one of my classes is Tom Petty. So he had quite a bit of fentanyl and other drugs in his system when he died. And there are media accounts where they're like, oh, he was like beloved and, he took these medications just so he could continue to go on tour. And if it was someone else, it'd be like, oh, they're an addict. They're
Yep.
a junkie. They're,
Yep. They shouldn't have been doing it. They got what they deserve.
Right. And I certainly don't want to apply that to Tom Petty. I would like it to go the other way where we have compassion and empathy for why
Right.
people are doing
Those people were
things.
suffering,
Yes.
right? And we often do not even have that level of compassion and empathy for offenders, right?
Exactly.
Especially minority offenders, especially offenders from lower income communities. We just see them as criminals as bad, as animalistic, right?
Mhm.
And and I think about these offenders from minority communities or lower income communities in very similar ways to the individuals who are white and upper class that offend. They're offending to me for the same reason, and that is survival in this system that we've created. In whatever, like whatever that looks like. It looks differently,
Mhm.
but it's really the same thing. We're trying to survive in this system and live. And I know that we've talked, I think you've read Body Keeps the Score. We've talked about
Yes.
that. Yeah.
Yes. Yep.
And he talks about, our number one thing that we are all focused on is survival. Right. And I think about that all of the time when I think about wealthy individuals who embezzle or commit wire fraud or tax evasion or whatever. I don't see these individuals as these terrible, horrible people that are corrupt,
Mhm.
right? I don't even believe in this idea of evil,
Mhm.
right? I see these individuals as trying to survive,
Mhm.
right? And it just so happens that it looks differently than the addicted individual,
Right.
than the individual who was born into poverty. It looks differently, yes, because they have different circumstances, but the reasons are the same to me.
I think that's a really great. I never thought of it that way. I think that's great. I don't know if either of you are watching White Lotus right now, but there's a rich gentleman who got into some trouble. It's not totally clear. He opened an account for someone in a way that maybe he wasn't supposed to, and he's suicidal and he's worried about losing his whole family. And it's, you empathize with in
Yeah.
the same way you would anyone else, which I think
Yeah.
is interesting.
That's a really good point too, because when you start to think about, and this is highlighted, I think, among minority communities as well as lower income communities, these are the communities that are most impacted by the justice system. So I keep referring to them, but
Right.
it's highlighted. We do not seem to empathize or have compassion with, or even understand on a basic level the reasons why these communities have higher rates of mental health challenges, right? And I don't even know the data on substance use. I know that it cuts across all demographics, but I think that it would probably be significantly higher among these communities if just thinking, theorizing. And it is because the threat to their survival is greater in these communities. And I keep going back to The Body Keeps the Score, Bessel van der Kolk, when he said survival. To me, that is the answer. Like, if we can understand, it looks differently across all demographics, across all individuals. Because survival looks differently. What it means to me and what it means to you are very different things, and so to bring up that example of like this individual who is being threatened to lose his freedom and his safety and his security, everything that he knows, that security system for himself on an internal level, and to suddenly be struggling with suicide or whatever mental health challenges, really highlights how important surviving is for us. And being able to meet basic needs. And again, basic needs vary, some people need some things and some people need other things. And I think that when we start to talk about justice, that I think is the answer. That's the key that we need to focus on, right? And, to me, justice is about people getting what they need.
I personally don't believe in the concept of deserve.
Right.
I love what you're saying, like getting what you need. If
Yeah.
people with intentionality, with consistency, were getting what they needed, so much would be different. So much would be different,
Yeah.
And then I also think we were talking a little bit about like language, right? And I think, we do such a disservice with, they're predators and they're criminals and they're, no, they're people.
Yeah, they're just people.
They're
And
people.
yeah,
absolutely. I have the same conversations. Like, I even have in, I think, my syllabus, like the foundational motto we have in my courses is most people are good, well-intentioned humans. That is the foundation of all of my courses. And I don't believe in the concept of evil. I don't. And people argue all the time with me like, oh, you can believe in good, but you can't believe in evil. These are not opposites. You can't set them on opposing sides and equate them to me, right? I think that bad things happen. I think that hurt people, right? But I don't think that comes from a place of malice. And I don't necessarily believe that malice actually exists. I think that, as Vander Kolk said, that we are all in the pursuit of survival. And and it's highlighted back in the caveman days, right? It's highlighted there. We can't see it now, right? Because we have so many luxuries.
Right.
We can't see that we are all indeed really focused on survival. And I also talk a lot about the idea of liberty, right? And so a lot of people use the word freedom. And we did an episode a while back about freedom and liberty. Our Constitution talks very little about freedom. In fact, it talks almost exclusively about liberty. And if you really think about the way that you as an individual act and respond, it is almost always in relation to your own liberty, right? So I use children as an example, and then I use offenders as an example. Almost all conflict comes from situations when people are trying to restrict your liberty, right? So a child is trying to exist and survive, right? And then a parent comes in and says, no. And a conflict arises because that is a challenge to their own liberty. They wanted to exist and go about in this way or that, and you are restricting that, and there's a conflict, right? And if you notice, as children grow older, one, they do a bit of assimilation, right, and conformity. But as they become adults, the conflicts between children and parents minimizes, it reduces, because their ability to make their decisions for themselves is increased and their parents' is limited, right? And so they're able to pursue their liberty more fully,
right?
Almost to the point of 100%. And then they're introduced into the world, right? And they are acting out of their own survival in pursuit of their own liberty, right? And some entity comes in, whether that's their job, their boss, their friends, whatever, and tries to restrict their liberty, and a conflict arises, right? To me, we're all engaging with our own liberty in pursuit of survival, whatever that looks like, right? And so when we start to talk about this idea of what people need, that to me is much more important than any other concept, because when we start to give people what, and I've had this conversation all the time with practitioners, they're so focused on you need to do this, right? To tell them. And if they would just reverse that and say, what do you need? Right. How can I help you? What can I do for you in a truly like helping profession way? We would achieve just as much better, much quicker, because we would really be focused on the needs that these individuals have rather than what we think they deserve.
Right. For many, many years, I worked with practitioners when I was supervising on motivational enhancement, figuring out what the person wants to work on, what motivates them, what will get them to change behavior, in their own best interest, as opposed to us trying to be the expert and the authority and putting on them what we think they should do.
I think that that's where our greatest challenge is we design and develop all of these programs and then say, you need to complete this. You need to do this. And, like there's an example in The Body Keeps the Score of an individual who says that anger management is great and all until you're angry.
Yeah.
And that is the way that we've developed all of our programs. In theory, they sound great. In practice, they don't work. I know all of the little tools and tactics about anger management, but when I'm angry, do I have the presence of mind to sit there and go, okay, let me pull out my notebook, my toolkit,
Yep.
right? We have to learn how to manage things differently, right? And I'm not an advocate for anger management because to me it's vilifying anger.
Mhm.
I think that anger is a valid emotion
Mhm.
and a necessary emotion and one that is kind of our own internal system saying, hey, this is not right. And if you're not going to do something, well, I am. Right.
Yep.
And so I'm more of an advocate for like emotion management,
Mhm.
learning how to manage our physiology, one, and then our, thinking processes because you can't engage with thinking processes and still you can manage the physiological processes, right? And we have much more control than we think we do. Most people are like, I don't have control over it. Yes, you do.
Of course.
I can control my breathing. I control my heart rate. Like I can manage those things.
Exactly.
We can do much more.
Yeah.
And, Vanderkolk points that out in The Body Keeps the Score. But I think that we're doing a disjustice. Is that even a word?
Injustice?
An injustice. I think that this is different than an injustice.
Okay.
It's like disservice.
Okay.
A disjustice. I don't know. I'm making it up. Somebody put it in
I
a
think
book.
it makes sense.
Sure.
Yeah.
I know what you mean when you say
A
that,
disjustice. When we are not focused on needs. And we say we are, though, on paper. We do the needs assessment
We do a needs assessment.
and a risk assessment,
Yeah.
right? And then we say this individual needs this. But really what we're doing is dictating.
Mhm.
We're telling them these are the things that are wrong with you, right? And if you don't buy into that, okay, I'm going to check this off the box, right? And then I'm going to move on.
And not to veer too far, but part of the reason we do that is the funding and auditing and credentialing requirements that are placed on practitioners. So, some of it is, I'm sure, a philosophy that has to change on the therapeutic level, but some of it is what we're being required to do.
Yeah, and it brings up this idea. I had a conversation last semester with a student in my policing course, and it was basically this idea that we're overriding ourselves. So we're trying to give ourselves as individuals so many rights that we've overrided ourselves to the point where we can't even act. And so it gives me this idea that we're over regulating, right? So we want to create so much uniformity and so much continuity in things that we're tying our own hands. Right. We're preventing ourselves from doing anything. And I think that America is in that problem. It has that problem across everything.
Right.
Right. When you look at other countries and you look at their culture, right? One example is like, for example, Mexico, right? Mexico, their culture, it is very much familial. It's a very communal type of thing. They are really focused on supporting each other, okay? And they also have a huge entrepreneurial spirit about them, right? And so you'll see, roadside stands and little, back of the truck markets and all of those things. They're everywhere. And this is a norm, right? And it's not looked down upon at all. And in fact, people will provide support by going and frequenting to the taco truck, to the little farmer on the side, to all of these things, right? But in America, like food trucks, while they're gaining momentum, it's only a certain demographic, right? And that's the middle class, the upper class, the people that have the money to have the really fancy ones, and they're in fairs and festivals, right? And if you see a taco truck on the side of the road that doesn't meet that criteria, well, people don't go there, people don't frequent it. And there's even ordinances that are regulating like food side vending. You can't do this, you can't do that, and you need a permit for that, and you need a permit for this. And we're so hyper focused that the little roadside stands and the taco trucks, they exist in their own world. And then you have like the mobile food industry, right? the moo, and it's like they're at the fairs, they're at the festivals and all of those things, and you see the demographics, the white, middle class, upper class, those people are frequenting that. And then you see the individuals that are in this very small, distinct community frequenting the taco trucks that are because that's a part of their culture. And so in America, we've gotten into this place where we're over regulating, we're over, trying, like we're purifying everything. And we do that, and it gets to a point where we're restricting so much. And you can see this with nonprofits too.
Yes.
So there's a lot of people with a lot of good ideas that want to do a lot of good work, but they're cut off from the system because they don't meet the criteria, or they don't know how to access it, or they don't have the resources to access it. And only those people that, have those resources can actually get into do that. And then we have a lot of non-work that happens in those industries, like a lot of wasted resources, a lot of inaction. I can think of countless nonprofits that I've, like volunteered at, and it's just like all of the wasted time, energy, resources. Like what is going on? They're not actually helping people, and they're just siphoning. And so I think in America, this is a disjustice that we're doing.
And so much about all of that, we might discuss this before, so much about treatment and helping people and meeting needs is relationship. And you can't
quantify that.
Right.
And you can't you can't say this is how you can, like, it's just, it needs to be organic.
Yep.
Right. And it's extremely, extremely frustrating, because that's where the work, that's where the help really occurs. I've heard countless times from women who've entered into shelters. And one of the first things is they're required to give up their food stamp card and their benefits, and the shelter siphons it to pay because they're living there for that time. And I'm just thinking, like, what?
Yeah.
Right? Is this about helping a victim? Is this helping someone in need? Or is this something else? Like, I'm not a participant in that system. Like, I don't understand. It does, to me, that should not be the first thing you're thinking about.
Right.
This is going back a little bit to the relationships thing. I don't work with addicts. I've never been in a women's shelter, but I do work with kids, and I work at a learning center. And one of the biggest things there is, it's like, you build these relationships with kids, and then they can tell you when they're struggling. Like, and the way my boss is structured, it's focused on this math and reading aspect. But beginning that, you get to know these kids, and they start to tell you about their lives. And I have, for a couple kids, become someone they come to all the time, and they just talk to me about life. And like, whether it be their parents' struggles or their struggles in school, and a lot of this stuff. And I've had to tell my boss and be like, hey, like, this is happening in this kid's life, and I'm not sure if there's something we can do about it. But I think that applies to everything in life. Like you said, with relationships, I don't think there can be any change made in this, like, power, punishment, justice system without those relationships being built.
Yeah. And so much of our justice system is, it works against relationship building.
Oh, yeah.
Like, every single, to me, I could not tell you, like, even if you think about, like, probation officers, their job is really to provide support to these individuals, but it is very much, I mean, even if you think of the name officer.
Were you looking at me because of some of my experiences? Yeah. So I was a probation officer for a short time because it was not my jam, for sure. Everyone in the office had that attitude I mentioned earlier of, like, well, they deserve to be here. And whenever an appointment would come, whenever one of my people would come, I would go right out and meet with them because I wanted them to get out there and find a job or take care of their family or do their treatment. It was people with domestic violence, and they were in batterers and intervention. But none of my other colleagues or even supervisors had that attitude.
Yeah.
That's
they make them wait.
That's something that you said that stuck out to me the most. Because, I mean, I'm 19. I've lived a privileged life. I've never experienced any of this. And that's something that you said that really, like, hit me.
Yeah.
Where I was like, wow, they just don't really care. And that's not something we should be having in, like, correctional facilities and correctional institutions. People should care.
Absolutely. And another challenge is, when people do care, the system is not receptive to that. I had a student who he graduated about a year ago, I think, and he wanted to either work in law enforcement or work in probation. He had a helping spirit. He wanted to help. And we worked really hard, and he actually got hired as a probation officer, right, in Manatee County. And I spoke with him a few months after he completed all of the training and started into the job. And he said, I left the job. And I said, well, why? And he said, they just wanted me to do what they wanted me to do. And I had no capacity to help.
Mm-hmm.
He said, I was just surveilling these individuals, and I was not allowed to actually help them in any capacity. And that's not the work I want to do. And he said, I took a job in the school in discipline so that I can help kids. Right. And he said, and here is a space where I can actually help, because I get to decide on what the discipline looks like, and I can use that as an opportunity to help them. And it's just so disheartening, because that profession is quite literally to receive these individuals and help them successfully reintegrate back into society with all of the struggles and all of the challenges. And that needs to be an extremely strong relationship, supportive relationship, and we don't want that.
No, and you're looked at as soft or all sorts of negatives. The philosophy around most correctional, even when I was working in treatment centers, counselors were very punitive. And thankfully, I got into a position where I was able to make culture change so that it was clear to the people, at least working for me, that no, we're not here to punish, we're here to help. But it's like a fear of being vulnerable, or, oh, they're going to fool me or trick me, or, I'm glad to hear you say that was surprising, because it's easy I'm not a jaded person, but like I am used to that being how it is. So it's nice to hear you being like, that's not how it should be. No, absolutely not. But that's almost 100% of anything that touches corrections. There's a very like jaded or armored up, or they're not going to fool me. They're not going to trick me. I'm not going to get a really, they get what they deserve, or they shouldn't be here.
I think that's across the justice system. I do.
Yeah.
I think that law enforcement go into that profession very much as the ruler.
Yeah.
Right. And it's a power thing. This is not to say that everybody is like that, but the vast majority of the
structures.
Yeah, we're talking about the persona of these different roles, right? And the system that we've created, it's very much we know what is right and what is wrong, and you've done what is wrong, and we have to fix you. Right.
Well, that's also because it's very paternalistic, right?
Absolutely.
So it's me, which goes back to what you said before. Instead of me saying to my child, what do you think you'd like to do with your life? Or how do you want to get this homework done tonight? Do you want to do a little and take a break? Do you want to just push whatever? We tell people, but these are grown people generally, how to do it, what to do. And of course they balk at it, like you said. Yeah. Instead of, because it's paternal, we think we know better.
Yeah.
And I think I became so much better at every job I've ever done when I realized that I'm not any better, and I don't even know better. I may have some knowledge you don't have that I can share with you.
Yeah.
But that's for you to take or leave.
Yeah, for sure. I think you really highlight a good example too, especially like with children. And I had this experience like a couple of weeks ago or something. I had a very authoritative childhood, like, and of course, like in that time period, it was very much, the children do as they're told, and the parents are in charge and all of that. And my children have a very different upbringing, a very different experience. And the, I don't know, it's been a week or so or something. And I asked my son, I was like, can you take out the trash? And cause that's his job. And he was like, yeah, can I get a few minutes? And like, I was like, whatever. I don't even think I said anything.
Right.
It doesn't matter to me. But in the moment, like I heard those words from him, and I was reflecting, and I was thinking, that's wonderful. Because I didn't instantly say, no, I said no, and I was just thinking back to like my childhood, like, oh, if I was that child, like there would be no way that
Right.
that would fly. Right. And, like when we think about the justice system, it's very authoritative and dictative to these individuals. Like I worked in substance abuse for a very short period of time. It is not my jam. I can't do it because I cannot handle the emotional aspect of that, the emotion part of that. But I had a lot of experiences. One, there was a girl, she was, struggling with an addiction to Klonopin, and she had lost her children to DCFS. She came from a pretty wealthy family. They had the money to pay for treatment, and she had a car, but she had to reside in Kim Free. And so that was a challenge because she had a wealthy upbringing, and
Right.
Kim Free is not cushy.
Uh-huh.
It's not nice. And she was required to go through outpatient treatment, but she lived in Kim Free, right? So in Kim Free housing, you had meeting requirements that you had to attend every day. And I think there was a couple of meetings. She was in outpatient treatment, and that required group and individual sessions, right? And that was almost daily because I think it was pretty intensive. And then she also was required by the drug court program, right, to attend AA. And it was like 5 meetings a day, right? Because her addiction was really severe. And then as a requirement for DCFS to get her kids back, she had to attend parenting classes, and like there was a few other things, right?
Sure.
And she was struggling.
Yeah.
And so I sat down with her. I'm like, okay, let's work out a plan, right?
Yeah.
And so we wrote down like everything that she had to do in a day. And it was something like 9 meetings in a day, right?
Wow.
And I remember thinking, I'd be taking Klonopin too. I would be right there. So, like, and there was nothing that I could do to say to her that would change the fact that this was unrealistic.
Yeah.
I could not sit there and shame her and say, you should be able to do this. I was just like, how can they expect anyone, right? Yeah. Anyone who has all of their needs met, who has all of the resources in the world, right? All of the support, right? For me, 2-3 meetings a day, I'm done.
Yeah.
Right? Like I need some, like I'm going to go on like a 5-mile walk, 0 noise, be with myself, right?
Yeah.
And you want this person who's struggling, right?
Yeah.
With support. She's struggling with her own internal mental health issues, her substance abuse. She's struggling to manage the relationships in her life, the loss of her children. She's struggling to deal with living in Kim Free. Like, I'm sorry, but Kim Free is really close to incarceration. And these people are all struggling, right? You want this person to manage all of that and go to 9 meetings a day and engage and pick it up and understand and grow and evolve and reflect.
I'm just trying to do the math of how you
It's-
do 9
yeah.
meetings a day. And
Yeah,
then
me
it's
too.
just,
Yeah. Oh, and it was even worse. There was another guy who did not come from an affluent family. He had very similar things, except for he did not have children. So that layer was gone. But he was required to pay out of pocket for his drug court costs, his electronic monitoring, his substance abuse, his treatment, all of these things. So he had to work. And at the time, the electronic monitoring system that we had was $750 a month. And he worked construction, which does not pay super great, right? And he was like, he had to be up and at his job at 6 o'clock in the morning. And he's like, I go do a 5 o'clock meeting. I go to work. And he had a vehicle. And he's like, my lunch break, I do this. And then whenever I get done, he's like, I had to go to these meetings and I have to make sure I meet curfew. And it's just like, both of them people relapsed.
of course they did.
Yeah.
I would too.
We set them up.
it's unrealistic. And so I'm not an advocate of drug court. Like I think that it just creates more barriers for other people. I don't think that that's justice. I think that it's another one of those things that we have good intentions, right? But then we over regulate and we over restrict. And sometimes I don't think that people are actually sitting down going, is this doable? Is this realistic for these individuals?
Right.
Right.
I agree. I mean, I generally support the drug court model, but I definitely understand the idea of overtaxing people and not looking at what's realistic. And like I said, that's what I dealt with a lot in probation. Now, when I was doing treatment, it was residential, so it was a lot easier because they didn't have to go.
Yeah.
We had pretty much everything they needed to do on site with us. We did do a good thing though that you mentioned earlier, which was we had them basically practice their skills. The first 3 months they were in-house, and the last 3 months they went out to work, but they came back to us at night. So they got an opportunity, like you said, with anger management or with relapse prevention, or my day sucked, what do I do? Normally I would come home and use this drug, so there was some at least practicing of the skills ideal, but.
And I think we're always practicing, like and the more you practice, the better you get. Cause like all situations are different. Like there's not ever like, this is exactly the same as the last time, like I get triggered different ways by different things, and I have to manage those and self-reflect and figure out how to do different, but sometimes I engage with that entire process. And sometimes I'm just like, I just need to de-stress. And then I'm walking away from like, I don't need to reflect, like whatever, but I think that what it really boils down to is we're talking about humans.
Exactly.
Right. And I read the book Just Mercy. I don't know if you've read that book.
I have not.
Brian Stevenson. There's a movie now.
Okay.
Read the book. It's better. But Just Mercy, it's a good book. It has a good message, but the basic takeaway from that, I can't get on board with.
Okay.
And that message is we're all broken. And I do not believe that we're broken. I believe that we're human.
Right.
We make mistakes. We exist. And we're all pursuing our own survival and trying to maintain our own liberty to do that in the way that we see fit, right? And I think that justice looks like individuals having their needs met and their liberty respected. And I think that we can create a system that's focused on that, not punishment.
That would be amazing.
So
I support it.
Well, thank y'all for coming out and talking to me. I enjoyed this. It was great. You are watching Justice Talks. This is the podcast where we use trauma responsive practices to inform criminal justice reform.